It's interesting, just building on what Pushpa said, that if we have 3.3 million nonprofits and technology could be a way to make this giving more inclusive, we learned that it is only 30 nonprofits in the entire country who ask people to give. The rest of the long tail of the rest of the millions don't even go out there to ask because they don't think that they are going to get money. And from the donor side, the chief reason that an individual giver is not giving is because he's never been asked. So it is extremely interesting to see both these points play out, and the kind of hard work it's taken for just 9,000 when we compare to the 3.3 million that are existing out there, or even if we take 50% of those to be active, for those to be able to leverage these kind of platforms and reach out to a potentially a billion givers, right? So our next speaker is Piyush, and Piyush is the CEO of and co-founder of Impact Guru, one of the largest medical fundraising and NGO crowdfunding platforms. And here to tell us more about the kind of experiments they've been doing. It is interesting because when we learned that when you have to trigger people to give, there are 4 things that sort of convert that intent to money going to the cause. One is people that are motivated by the urgency, like disasters. People motivated by the community. I want to give because locally I feel more towards this particular person or this particular movement that's happening. And cost, some people are just saying, I think we need to pay attention to environmental footprint, and therefore I should give to causes that are working on, afforestation and so on, right? And the 4th is people that are truly giving because they want to make an impact, and they want to see that their funds are going to bring about some social change. When we look at the medical fundraising case, it's interesting to see that the trust issue may perhaps have been solved because medical fundraising in India has grown by crazy amounts. I mean, some studies quote the figures at 300 crores last year went from individual givers to medical causes. So would love to hear from Piyush how the whole intention converts to, resources for these causes.
Great, thank you so much, Aarti. Hi everyone, I'm Piyush. I'm the co-founder and CEO of Impact Guru. Before I begin, I think it will be very helpful if I can understand how many of you here are actually representing non-profits. If you could raise your hands. Okay, that's a pretty significant amount. How many of you are here representing companies from their CSR foundations? Okay, and how many of you are representing other grant-making organizations or foundations? Okay, so it's a great mix. So I will talk primarily about what we do in healthcare fundraising and what we have learned, but also how this is applicable to non-profits, to CSR foundations, as well as to grant-making organizations. So Impact Guru was actually started by me when I was actually a student at Harvard University. And our sort of vision why we decided to coin the name Impact Guru for our company was our basic belief that technology can allow us to get anybody in India to contribute. And people can contribute financially, but people can also contribute just by sharing something on social media. So on our platform today, even people can actually donate as little as 1 rupee, and there are lots of transactions that are actually happening with that amount. These are people who are actually just testing whether our platform is genuine or not before they decide to make larger contributions in the future. So let me talk to you about healthcare crowdfunding and exactly why this is working so well on all the actually leading platforms, not just in India but also globally. So crowdfunding, for those of you who are not familiar, is basically the idea that a group of people like this, if the 150, 200 people here, if they all contribute a certain amount of money for a particular cause, you can raise that money very, very quickly. And technology can do that very, very fast. And so in healthcare, in India, 1 billion people do not have health insurance. And those who actually do, IRDA data shows, the insurance regulator, that their average health insurance cover is only 5 lakh rupees or $7,000 US. And so when people have trouble paying their hospital bills, they typically resort to selling their homes, mortgaging their jewelry, and asking for help from their own friends and family. And this is where technology platforms like Impact Guru have made it very easy for people to make that ask and to actually be able to mobilize that money. And I think the best part about this is when you are asking money from your own friends and family in the offline world, it seems that you have a sense of obligation to actually pay them back that money. But in the online world, that's actually not true. It's actually a donation. The average donation on our platform is about 2,000 rupees, which is not a significant amount. And so Impact Guru, we are very lucky to say that we've been privileged enough to pioneer some unique kind of partnerships with hospitals. And so Apollo Hospitals, which is India's largest healthcare company, is actually one of the largest investors in Impact Guru. And with them, we've actually done a lot of innovations around how to ensure that patients who are in hospitals, who are critically sick, and if they need funding help, how to be able to do that. We've tried to do that with many of the other large private hospital chains in India. The reason I'm providing this background is to build up towards a case study which will illustrate some very relevant learnings for nonprofits. So at Apollo Hospitals, once we started the partnership, one of the patients that actually approached us was a woman called Gopi Shenoy. These were middle class people living in Mumbai, but unfortunately they needed to, the husband of Gopi, Amit, was actually diagnosed with cancer, and they needed to arrange 45 lakh rupees in just about a week's time. They needed to do an emergency surgery. And so they were searching online and they figured out that crowdfunding was a great way to do that. And so that's when they approached us and we decided to create this fundraising page. The reason I'm giving you this example is to talk about the power of technology. So they created this fundraising page where they upload their pictures, they wrote a short description of why they needed help, and uploaded their medical documents. And we asked them to share it with a few of their work colleagues and a few of their friends. And within 3 days, they were able to raise 40 lakh rupees. That's a very, very significant amount of money. So they raised this from 499 donors. The average donation actually for them was about 9,000 rupees. What was very interesting is Amit was actually working at McCann Erickson. When they saw this campaign, even the company decided to make a 5 lakh contribution on this campaign. So that kind of impact at that kind of velocity would not be possible without technology. When people are transacting through debit cards, credit cards, net banking, Paytm, UPI, and even people can RTGS and NEFT or IMPS that money to us, and we'll make sure that every penny is actually accounted for real time. So that is the power of crowdfunding. But inherent in the model why healthcare fundraising works is, I think, the key learning that most of the platforms have had, which is that in India, giving is primarily driven by the person who's making that ask. And that has been one of the biggest learnings for us. So in the context of nonprofits, who is making that ask is very, very important. Is it a volunteer? Is it a trustee? And who are they making that ask to? Because according to our research, no matter what cause you are passionate about, whether it's education, skills, training, women empowerment, the person who's making that ask is the biggest determinant of the success of the fundraising campaign. And that's where technology can actually play a very significant role in terms of scaling fundraising. So let me talk about some 4 unique type of campaigns that we have done with nonprofits, which I believe may have a lot of relevance to the audience here. When we had some of the recent floods in Maharashtra, America's India Foundation, which runs various programs, one of their CSR partners was actually Procter & Gamble. And when this happened, we reached out to them to inform them that why don't you leverage your CSR relationships as a nonprofit to try and do employee engagement to actually really raise relief related money for this cause. And they really loved the idea. They pitched it to the P&G team, and within about 2 days time they were actually able to get this campaign set up. And so then what P&G's HR team did and the CSR team did was to get the message sent across to the entire employee base of P&G. We've done this with various other corporates too, but I think this is a great way nonprofits, many of you receive a lot of CSR funding, can leverage technology leverage your existing relationships, and get more funds for some of your existing programs through employee engagement. A second example leveraging technology is a non-profit set up by a really fantastic entrepreneur who wanted to create a restaurant in Mumbai where autistic people can actually get employment. And I'm proud to say that they were able to raise 8 lakh rupees on our platform in just about a month's time, and this restaurant is actually operational today. And I think that's kudos to the fantastic storytelling power of this particular entrepreneur. And I would encourage most of you to actually visit the restaurant. So the power of storytelling, by creating a fantastic video and again leveraging technology platforms on Facebook, WhatsApp, etc., to make sure you have great reach. And every donor that contributes, get them to bring 2 donors each, right? That is not very, very difficult to do as a nonprofit. That's what technology platforms allow you to do, because we have a lot of data that we collect from various donors who are transacting. A third example, another disaster relief one with the recent Sangli floods that happened. This particular non-profit was able to raise 26 lakh rupees. A politically, I would say, connected NGO with very strong reach in the Maharashtra government, again was able to leverage that moment to again get the message spread out, and a lot of HNIs actually contributed on this platform, on this particular campaign. I think the last one is an example of how a group of individuals who have a good idea can really create a movement. So the story that my team narrated to me was that a bunch of people from IIM, ex-Teach for India fellows and Young India fellows were very passionate about providing more skills training opportunities to people in under-resourced schools. And so they had this idea that, in 4 skills training areas, can they provide a full-time volunteer who will train the underprivileged children to actually, upskill themselves to ultimately get jobs in the visual arts stream or in the sports. And they were able to, just leveraging their entire volunteer base, actually able to raise 10 lakh rupees in again a very short amount of time, which impacted over 1,100 students. So, non-profits can really leverage crowdfunding in very significant ways to do very interesting and different types of campaigns. If you are a corporate and you are already helping non-profits, you should encourage them to adopt crowdfunding and explore employee engagement activities. And if you are a foundation which is doing grant making, I hope that you can do various experiments with matching funds, which is the idea that for every 100 rupees raised, 10, 15 rupees can come from a matching fund pool, to actually push these organizations to really go out and raise more and more funds for these programs. So with that, I'll conclude my presentation. Thank you very much.